Hi, my name is Rhonda Freeman and I'm a neuropsychologist within a neurology practice. You may be watching this video because you have an upcoming appointment with me or a different neuropsychologist. Either way, I'm going to give you a little information about this type of visit. Now, the goal of a neuropsychological evaluation is to find out how your brain is functioning. And we look at three different areas. Pretty much we look at cognition, which is just another way of saying your thinking, your mood, or other conditions like perhaps anxiety. And then we also look at your behavior and social skills. We learn this information by giving you many different tests. As a matter of fact, testing takes up the bulk of the time that you'll spend with me or another neuropsychologist. And an example of some of the tests would be, I would have you remember a list of words. I'd have you remember pictures that I show you. That would be an example of some of the memory tests I give you. I will test your concentration, your attention regulation abilities. I'll look at how you problem solve, whether or not you can figure things out very easily. We look at your language, whether there are word finding problems or comprehension problems. And as you can tell, the cognitive tests allow us to see in action how your brain is functioning. I happen to be an adult neuropsychologist, so my patients are 18 and above. And one of my areas of expertise is dementia. So let me walk you through what it might be like for somebody who's being tested for dementia when they come to see me. First, we make sure that our patients are aware that before the visit, they make sure they get a good night's rest, that they have a meal. So if they're my morning patient, they will have had their breakfast. And if they're my afternoon patient, they will have had their lunch. They will be offered breaks during the assessment. Usually the testing time that I spend with them is around 3 to 4 hours. So it is a bit of time. It is a bit lengthy. They are welcome to bring someone with them. I really like it when my patients bring a spouse or a family member or an adult child with them. And in that way, I can interview both individuals and get a complete picture of what you're like and what changes they may have observed in you, as well as you telling me the types of symptoms that you might have. And prior to that interview, I will have already read your medical records. So here in our neurology practice, that usually means I've read your neurology notes. If we have any notes from your primary care doctor, I've reviewed those. And any neuroimaging or blood work, I've also taken a look at those. And that way I'm prepared for you when you get here in the office. During that interview, I'm going to not only ask you about your symptoms and learn more about your past, I'm also going to observe how you interact with me, how you interact with your family member. I'm looking at social skills. I'm looking at behavior. Are there any problems or difficulties in emotion regulation and self-control? Is there a sad mood? Are there problems accessing words and understanding what I'm asking? So the interview process is very important to the neuropsychologist because not only are we gathering history, we are observing. At the end of the interview, if you brought along a spouse or a family member, that's when they're excused and you and I will then get into the testing, or you and your neuropsychologist. Once the testing is complete, the neuropsychologist will then, on their own when you're not present, score up all your data. Now when it comes to scoring, we will compare you to your age and education and sex and gender group. And that means, for example, if I have a 75-year-old patient who is male, who has 16 years of education, he gets compared to a very similar cohort. So, for example, we wouldn't compare somebody who's 75 to somebody who's 25. Your results are scored and interpreted and then provided to the referring physician. Usually in this practice it's the neurologist, sometimes it's the primary care doctor. And after that, I really like going over the results with the patient. So that's the general process of a neuropsychological evaluation. You don't have to worry about getting prepared in any way or studying any information. Just make sure that you show up well rested and fed. And if you're one of our patients here, I look forward to seeing you. Everybody else, take care. Bye.